Hello friends, hi, good morning. Welcome to our channel, The Voice of Nurse. Today we are going to discuss a questions and answers regarding the subject of medical and surgical nursing point of view. We already finished part 1 and part 2 from the question number 1st to 30 part 1, from the 30 to 60 part 2 we already discussed. Now we are going to discuss part 3 from the question 61 to 100 questions. In this video we will discuss 40 questions with explanation. Once again I am mentioning regarding the questions and answers with explanation, only important picked questions, and also some of the questions we already got in previous exams also. Before moving on to topic, a small request friends, anybody watching first time my channel, please subscribe my channel, click on the bell icon for further notification. Please share my video to your friends and please support me friends. Let's move on to topic, the medical surgical nursing point of view continuous part 3. Before moving on to topic, I am apology to all my dear viewers regarding in previous video part 2, the 40th question I did some mistake. Actually the hepatitis B is DNA virus, but hepatitis A is RNA virus. But in this part 2 video, at the 40 question, which one of the following is a DNA virus means I explained is hepatitis A is RNA virus. But I mentioned here the answer is hepatitis A, but here the DNA virus means hepatitis B. Here hepatitis A is the RNA virus, hepatitis B is a member of hepatitis DNA virus group, double standard DNA virus. Here option B is the correct answer, but in that video of part 2 I mentioned option A is the correct answer. That is wrong. My side I did a mistake, so I am giving apology to all my dear viewers. Next time I will not repeat this type of mistakes. And one more thing I have to thanks to my dear viewers regarding somebody has given a comment like option A is not correct here, option B is the DNA virus. Please tell me the correct answer, like that they give a comment to me. So thankful for that. Thankful to them. Next I will not repeat like that mistakes. Next we will move on to question number 61, today topic from the part 3. 61th question. A patient with noisy breathing, nurse suspects laryngospasm with stridor and it occurs commonly with. Patient is having noisy breathing. The nurse suspects laryngospasm with stridor. It will occurs commonly with from the options. We will see here options. Option A hypercalcemia, option B hyperkalemia, option C hypokalemia, option D hypocalcemia. Here in this question stridor is there. Stridor means nothing but noisy breathing. The medical term for stridor meaning is noisy breathing. The stridor is a condition that causes you to make a high pitched whistling noise when the patient breath in or out, means when the patient is taking in and out breath time, the noisy breathing will come from the patient. It is one of the complication or causing from the hypocalcemia. So here option D is the correct answer. How hypocalcemia will cause the stridor? The most likely a sort of laryngeal collapse due to the loss of rigidity by the hypocalcemia. In infants, not only in adults, in infants also they will deficiency of rickets. The infants will develop a rickets due to the hypocalcemia deficiency, and infants rickets will starts with a hypocalcemia due to the lack of vitamin D in the children's. Here the noisy breathing due to the commonly a, option D is the correct answer, hypocalcemia. Next we will move on to question number 62. The 100 days cough is used for which disease? The 100 days cough is used for which disease? We will see here option A measles, option B tuberculosis, option C diphtheria, option D pertussis. The 100 days cough is used which disease means the continuous cough will be there in some of the patient in 100 days. So which of the condition we can see the 100 days cough? Here, 100 days cough is highly contagious bacterial upper respiratory tract infection characterized by the Bordetella pertussis. Option D is the correct answer here, commonly known as whooping cough also. In commonly used the term pertussis is whooping cough. What is the medical treatment for the 100 days cough or pertussis or whooping cough? Actually, erythromycin is the medical management for the whooping cough or pertussis. Full dose of erythromycin is 14 days. The patient have to take in short days, means short dose of the erythromycin is 7 days. Here the pertussis is the correct answer. Next we will move on to question number 63. Agranulocytosis is characterized by. Here in this term, agranulocytosis. Granulocytosis means, granulocytes means WBC, white blood cells. Agranulocytosis means the low number of the granulocytes, means white blood cells. In question only is there in this meaning. And we will see here before answer, we will see here options. Option A, leukopenia. Option B, stiffness of neck. Option C, abdominal pain. Option D, all of the above. Here, the agranulocytosis is a serious condition that occurs when there is a extremely low number of granulocytes or WBC in the blood. Granulocytes are important part of the body immune system and help the body fight against the infection. Agranulocytes means absence of the white blood cells. Related to these options, option A is the leukopenia is the related to the blood disorder. So here option A is the correct answer. Next we will move on to question number 64. Lyme's disease produced a characteristics and annular circular rash known as. Lyme's disease is produced a characteristic, that is the rash, circular rash, annular circular rash also known as. We will see here options. Option A, papules. Option B, plagues. Option C, bullae. Option D is bull's eye rash. The most common early sign of Lyme's disease is a skin rash that has a bull's eye appearance, looks like bull's eye. The rash looks like in middle is red dot and the increases size around like a ring. In the middle of the rash is red color and around the ring, means around the rash is ring like circle is there. That is called as bull's eye rash. So here Lyme's disease produced a characteristics annular circular rash is called as bull's eye rash. Here in this picture we can see the bull's eye rash in the particular areas in our body. Here we can see second picture, the center point of is red color and circle is there in red dot around. This is called as bull's eye rash. Next we will move on to question number 65. An elderly client with pneumonia may appear with which of the following symptoms first? The elder patient is having pneumonia and the first symptoms of the client. We will see here options. Option A, hemoptysis and dyspnea. Option B, pleuritis, chest pain and cough. Option C, fever and chills. Option D, altered mental status and dehydration. In case of pneumonia, the symptoms like fever, chills, hemoptysis, dyspnea, cough and pleuritic chest pain, these all are the common symptoms of pneumonia. But in case of elderly clients may first appear with only altered mental status and dehydration due to the blunted immune response. So here option D, altered mental status and dehydration is the first symptom of pneumonia in case of elderly client. Here option D is the correct answer. Next we will move on to question number 66. When either volume overload, nerve volume contraction appears likely, which of the following should be considered? Here the either volume overloaded, nerve volume contraction appears likely, which of the following should be considered as the condition? We will see here options. Option A, adrenal disorder. Option B, pituitary disorder. Option C, liver disorder. Option D, SIADH. Here I have to explain SIADH. Why? Because of short form is there. SIADH means syndrome of inappropriate antidiuretic hormones secretion. So here SIADH means syndrome of inappropriate antidiuretic hormone secretion. Here identify the cause of hyponatremia can be complex when either volume contraction nerve volume is overloaded appearance likely SIADH is considered. So here option D is the correct answer. Either volume overload nerve volume contraction appears means the syndrome of inappropriate antidiuretic hormone secretion is the correct answer here. Symptoms like nausea or vomiting, cramps or tremors, memory impairment, confusion and irritability, seizures, and also some of the personality changes, and also finally they got coma. So here option D SIADH is the correct answer. Next we will move on to question number 67. RH factor incompatibility can be produced. The RH incompatibility can produce. We will see here options. Option A AIDS, AIDS. Option B sickle cell anemia. Option C erythroblastosis. Option D Turner syndrome. Turner syndrome is the one of the chromosomal abnormality, and option A is one of the sexual transmitted disease. Here either option B or option C related to RH factor means blood disorder, sickle cell anemia or erythroblastosis. So here what is RH incompatibility? A serious life-threatening condition in infants. Not only in adult, this is one of the life-threatening condition in infants. Erythroblastosis fetalis calcified result from the RHO incompatibility which may develop when a woman with RH negative blood is pregnant by a man with RH positive blood and conceives a fetus with a RH positive blood. So means here in this mother is RH negative and man is means father is RH positive. So conceived a fetus with a RH positive. So here RHO incompatibility is occurred in erythroblastosis. Option C here correct answer. Next we will move on to question number 68. In which of the following organs of abdomen Peyer's patches are found? Peyer's patches, PPS, Peyer's patches are found. We will see here options. Esophagus, option B large intestine, option C stomach, option D small intestine. Here the patches is occurred at the around of the abdomen organs. These all are the Peyer's patches. We will see here options. Option A esophagus, option B large intestine, option C stomach and option D small intestine. The PPS Peyer's patches is a series of small lymphoid organs situated in the wall of the small intestine. The B lymphocytes reside in germinal centers of the small intestine. So here option D is the correct answer, small intestine. The abdomen Peyer's patches are found in small intestine. The B lymphocytes reside in germinal centers of these follicles where there is naturalization takes place and parafollicular zone will happen here. So here the abdomen Peyer's patches in seen in small intestine. Next we will move on to question number 69. Antidote for coumandin. The antidote for coumandin. Coumandin is nothing but warfarin friends here. Other name of coumandin is warfarin. Here option A vitamin K, option B amino aphoric acid, option C potassium chloride, option D protamine sulfate. Here a dose of vitamin K is used to reverse the action of warfarin. A blood thinner used routinely for more than half in century and until recently the only such option for most people. Vitamin K is the only effective antidote for long-term management, but it will take several hours to reverse against anticoagulants. So here antidote for warfarin or coumandin is vitamin K. Option A is the correct answer. Next question 70. Clotting factors such as prothrombin are produced by the The clotting factor prothrombin is produced by options: option A red bone marrow, option B liver, option C spleen, option D lymph nodes. Prothrombin, the inactivate precursor to thrombin, is synthesized by the liver. So here option B is the correct answer. Is synthesized by in the liver in vitamin K dependent reaction and is released into the circulation of prothrombin is a protein made by a liver, one of the coagulation factor. The prothrombin is one of the coagulation factor. Next we will move on to question number 71. Which of the following is the location of the cardiac centers in the nervous system? From the options, we are having a cardiac centers of the nervous system. We will see here options. Option A, cerebrum. Option B, hypothalamus. Option C, spinal cord. Option D, medulla oblongata. Medulla. The regulation of the heart and peripheral circulation by the nervous system accomplished by control centers in the medulla oblongata. Here option D, medulla, is the correct answer. Medulla oblongata is the cardiac center of the nervous system. Cardiac center is a part of the heart. It regulates heart rate through the nervous and endocrine systems. So cardiac center is medulla. So here option D is the correct answer. Next we will move on to question number 72. Long-term complication of diabetes are related to damage to the options: bones, option B blood vessels, option C liver, option D brain. The long-term usage of diabetes complications means long-time usage of diabetes medications or complications of diabetes is damage of blood vessels. Option B is the correct answer, which can lead to heart attack, stroke and problems with the kidneys, eyes, gums, feet and nerves. High blood pressure or high glucose levels can damage the body of other organs. Next we will move on to question number 73. Trismus is a presenting symptom of. Trismus means lockjaw. Trismus is also called as lockjaw. We will see here options. Option A tetanus, option B smallpox, option C typhoid, option D chickenpox. Trismus is the most common presentation of tetanus infection in 50 to 70 of cases. Means 50% to 70% of cases the trismus we can see. And it can cause serious problems with eating and speaking, swallowing and maintaining the improper oral hygiene. So here trismus is presenting symptom of tetanus. Option A is the correct answer. Next we will move on to question number 74. A priority nursing diagnosis for a client with paget's disease would included. What is the priority of nursing diagnosis for a patient with paget's disease? We will see here options. Option A pain, option B knowledge deficit, option C fluid volume excess, option D fluid volume deficit. What is Paget's disease? Paget's disease is a abnormal bone disorder. Paget's disease of bone is a chronic bone disorder. Normally there is a process in which the bones break down and then regrow. Means the breakdown of the bone will happen automatically and regrow, means regrowth will be there. There is a excessive breakdown and regrowth of bones too quickly. They are a bigger and shorter than normal. So the symptoms like pain, joint pains and dull bone pain, joint pain, stiffness and swelling at the site of the bone. So here one of the most priority nursing diagnosis is pain. Option A is the correct answer here. Here in this picture we can see the Paget's disease. The bone is breakdown and regrowth, but it will be bigger and shorter than normal, means it is the abnormality of the bone disorder. Next we will move on to question number 75. Struvite stones are composed of. Struvite stones are composed of option A calcium phosphate, option B calcium oxalate, option C uric acid, option D magnesium ammonium phosphate. Struvite stones form when the urine becomes more alkaline. Main chemicals included in the Struvite stone composition: magnesium ammonium phosphate and calcium carbonate. Means here option D, magnesium ammonium phosphate is the correct answer. These stones can grow quickly and become quite large than normal stones. Here option D, magnesium ammonium phosphate is composed of Struvite stone in the kidney. So here option D is the correct answer. This picture we can see the bigger size of stone in the kidney. Next we will move on to question number 76. Azotemia means, what is the azotemia? Option A, accumulation of nitrogenous waste products. Option B, yellowish discoloration of sclera. Option C, yellowish discoloration of skin. And option D, none of the above. The elevated levels of urea and other nitrogen compounds in the blood is called as azotemia. So here option A, accumulation of nitrogenous waste products is called as azotemia. Option A is the correct answer. Azotemia is a biochemical abnormality defined as elevation or buildup of nitrogenous products and creatinine in the blood and other secondary waste products in the body. So here option A, accumulation of nitrogen waste products in the body. Option A is the correct answer. Next we will move on to question number 77. The 77th question is, what would the primary goal of therapy for client with pulmonary edema and heart failure? The primary goal of therapy for a client with having pulmonary edema and heart failure. We will see here options. Option A, peripheral edema is decreased. Option B, cardiac output. Option C, improve respiratory status. Option D, enhance comfort. Here, the primary goal of therapy for the client with pulmonary edema or heart failure is increasing cardiac output, and pulmonary edema is an acute medical emergency required to immediate interventions. So, we have to encourage client to take a breathing. So, we have to assess the breathing pattern of the patient. The primary goal and therapy of client with pulmonary edema and heart failure is we having two actually here. First priority is improve respiratory status. Second priority is cardiac output. Here option C is applicable. Next we will move on to question number 78. Howell Jolly bodies are seen in. Howell Jolly bodies are seen in. We will see here options. Option A, megaloblastosis. Option B, sickle cell anemia. Option C, thrombocytopenia. Option D, none of the above. What is Howell Jolly bodies? The Howell Jolly bodies are seen in pathogenic for a splenic dysfunction. So here the causes are radiation therapy involving the spleen, such as that used to treatment of Hodgkin lymphoma. Howell Jolly bodies are seen in ankyloidosis, severe hemolytic anemia and megaloblastic anemia, and also myelodysplastic syndrome. Myelodysplastic syndrome also we can see the hollow jelly bodies. The jelly bodies can seen in premature infants also. Some of the condition we can see the premature infants also. Here option A, megaloblastosis. Howell Jolly bodies are seen in megaloblastosis. Option A is the correct answer. Next we will move on to question number 79. 79th question. The most reliable way to monitor the fluid status in dehydrated client. Most reliable way to monitor the fluid status in dehydrated patient. We will see here options. Option A, intake and output chart. Option B, skin turgor. Option C, daily weight. Option D, lung sounds. Here option A is main and most important in nursing care while assessing the patient at the condition of kidney and heart diseases, and especially in fluid deficit means dehydrated patients. Intake and output chart. Important to monitor the client's alertness, urine output chart, and blood pressure, pulse, and daily weight monitoring is important. The signs and symptoms of dehydration patient are thirst, weight loss, dry mucosa, and sunken eyes and weakness. So the first and foremost thing is strictly maintain the IO chart, intake and output chart, the main goal of the nurses. To maintain a IO chart is the correct answer here. Next we will move on to question number 80. What is the first symptom patients report with presence of cancer of glottis? What is the symptom as reported from the patient is having cancer of glottis? We will see here options. Option A, pain. Option B, change in voice. Option C, difficulty swallowing. Option D, persistent sore throat. Here the first and foremost symptom is cancer of glottis is hoarseness of the voice or change in the voice. Option B is the correct answer here. Hoarseness of the voice is often an early presenting symptom of glottic cancer due to the vocal cord immobility and fixation with pain, with a swallowing and ear pain, and also some of the advanced diseases. So here first symptom patient reported presence of cancer glottis is hoarseness of voice or change in the voice. Option B is the correct answer here. Next we will move on to question number 81. When the patient's neck is flexed, flexion of the knee and hip is observed. What does mean? Here we will see here options. Option A, Corvick sign. Option B, photo face. Option C, Brudzinski sign. Option D, none of the above. When patient neck is flexed, automatically the knee and hip is flexed means option C, Brudzinski sign. So here option C is the correct answer. The Brudzinski sign is one of the physically demonstrable symptom of meningitis. In this case, severe neck stiffness causes a patient hip sign needs to flex. The neck is flexed. At the time of neck flexed, as soon as possible, the flexion of the knee and hip is observed. This is positive symptom for the meningitis. And one of the option A, Corvick sign, also one of the sign for the meningitis disease. Here we can see the Brudzinski sign. In case of patient is neck is flexed, flexion of the knee and hip is observed. We can see here the flexion of the knee and hip. This is Brudzinski sign. It is one of the sign for the meningitis. Next we will move on to question number 82. Opacification of lens called as. What is the opacification of lens? Option A, cataract. Option B, glaucoma. Option C, conjunctivitis. Option D, blindness. Here intraocular lens, IOL, intraocular lens opacification is an uncommon but serious complication of cataract. So here option A is the correct answer. This is one of the cataract surgery complication. It can cause significant disorientation of visual performance, causes are infection, injury, scratches, swelling of the eye, and one of the complication already discussed, the cataract surgery. After the cataract surgery, the complication of cataract surgery is opacification of lens. Here in this picture we can see the opacification of lens, the eye with cataract. Option A is the correct answer. Next we will move on to question number 83. Surgical intervention for hydrocephalus. What is the surgical intervention for the hydrocephalus? We will see here options. Option A, Glenn shunt. Option B, BT shunt. Option C, VP shunt. And option D, none of the above. Glenn shunt related to heart, and option B, BT shunt also related to the heart. Here option D is none of the above. So here option C, VP shunt is the correct answer. VP shunt is a cerebral shunt that drains excess cerebrospinal fluid when there is an obstruction in the normal outflow. Cerebral shunt are used to treat hydrocephalus. So here option C is the correct answer. VP shunt. VP shunt means ventriculoperitoneal shunt. Ventriculoperitoneal shunt. VP means ventriculoperitoneal. Here in this picture we can see the VP shunt in the children's, not in adult. This is picture for the children's ventriculoperitoneal shunt for the surgical intervention of hydrocephalus. Next we will move on to question number 84. The nurse performs a Montex test. Whether nurse knows the other name of Montex test? Nurse is performs a Montex test. The other name of Montex test what? We will see here options. Option A PDD, option B PDP, option C PPD, and option D DPP. Before discussion of the answer, I will explain what is the abbreviation of these options. Write down once, friends, here clearly. I will explain what is the abbreviation of these all are things. PPD means, first option we will see here, option A PDD. PDD means pervasive developmental disorder. It is one of the developmental disorder. Option B PDP. PDP means prescription drug coverage. PDP means prescription drug coverage. DPP. DPP means diabetes prevention program. Option D DPP means diabetes prevention program. Here option C PPD means purified protein derivative. So from the options, option C is correct answer. The Montex test other name is PPD, stands for purified protein derivatives. It is used to check for a tuberculosis exposure. All clients who had BCG need not to perform this test, because if they are taken BCG vaccine means automatically they will be a positive. So here related Montex test other name is PPD, purified protein derivatives. Option A, B, D is not involved in the Montex test. Here option A and B, D is not applicable here. Next we will move on to question number 85. Which hormones will control the sexual behavior? We will see here options. Option A oxytocin and vasopressin. Option B serotonin and melatonin. Option C androgen and estrogen. Option D thyroxine and adrenaline. Here, the sexual behavior in both sexes is strongly regulated by circulating concentrations of gonadal steroid hormones, including androgens means testosterone, estrogens means estradiol, and also progesterone, also one of the hormone control for the sexual behavior. So here androgen and estrogen, option C is the correct answer. Androgen means testosterone, it is the male sex hormone. Estrogen or estradiol, it is one of the female sex hormone. So here option C is the correct answer. Next we will move on to question number 86. The term RT PCR denotes. We all know RT PCR. What is RT PCR? RT PCR is one of the diagnostic evaluation to identify the any virus is present or not. This is the one of the diagnostic evaluation for the recently we are using in COVID-19. What is RT PCR denotes? We will see here options. Option A real time polymerase chain reaction. Option B reverse transcription polymerase chain reaction. Option C raised time polymerase chain reaction. Option D none of the above. Here the RT PCR means option B reverse transcription polymerase chain reaction is correct answer here. RT PCR means reverse transcription polymerase chain reaction. So here option B is the correct answer. What is RT PCR? RT PCR is test for the quantitative detection of nucleic acid from SARS-CoV-19 in upper and lower respiratory specimen is RT PCR. Nasopharyngeal route or oropharyngeal swab we will take for the diagnosis of COVID-19. RT-PCR is enables detection and presence of specific genetic material in pathogens that includes viruses or bacteria. RT-PCR is a laboratory technique combining reverse transmission RNA into the DNA and application of specific DNA targets using polymerase chain reaction. So here RT-PCR means option B reverse transmission polymerase chain reaction. Next we will move on to question number 87. The safest method of changing a patient's tracheostomy tie is. The safest method of changing patient tracheostomy tie. We will see here option. Option A apply the new ties before removing the old one. Option B, ask the doctor, suture the tracheostomy in place. Option C, never attempt to change ties to tracheostomy. Option D, none of the above. It is preferable to secure new ties before removing the old tie during the tracheostomy tie change. One person is to maintain the airway by securing the tracheostomy tube in place and not to removing the hand until the new tracheostomy tie are secured. Means we have to assess one more person. Means we have to need a one more person for helping while assessing the patient tracheostomy tie. While during this time, the nurse's major important role is taking care of tracheostomy patient is with maintaining aseptic techniques for the infection control and be careful because of tube will out or otherwise displacement of the tracheostomy tube will happen. So we need a help one more person to assess the tracheostomy tube while tying the tracheostomy tube. Applying the new ties before removing the old one. Option A is the correct answer. When we have to do tracheostomy tie. Tracheostomy tie we have to do before, means in the morning, early morning we have to clean the area and we have to do a suction. Then we have to assess it whether any sepsis, pus is there, bleeding is coming from the suture side, any tracheostomy side we have to assess and we have to clean with the surgical aseptic techniques and we have to tie the tracheostomy tube. So here option A is the correct answer. Next we will move on to question number 88. Guillain-Barré syndrome affects. What is Guillain-Barré syndrome affects? We will see here options. Option A brain, option B heart, option C lungs, option D peripheral nerve. Condition in which the immune system attacks the nerves. Guillain-Barré syndrome is a rare neurological disorder in which the immune system attacks part of the peripheral nervous system. It can cause muscle weakness and reflex loss and also numbness or tingling in the parts of the body. It can lead to paralysis also, but is not a permanent. The paralysis is temporary in these cases. Guillain-Barré syndrome. Here peripheral nerves will affect. So here option D is the correct answer. Guillain-Barré syndrome affects the peripheral nerves. Next we will move on to question number 89. Which of the following drug is used to prevent blood clotting during the hemodialysis? During the dialysis time, the blood clotting, prevent the blood clotting during the dialysis. Which drug is used? We will see here options. Option A aspirin, option B heparin, option C potassium sulfate, option D warfarin. Heparin and enoxaparin. Heparin and enoxaparin are the two main anticoagulant drug is used to during the time of hemodialysis treatment, used to prevent blood clotting or blood from clotting when it is filtered through the artificial kidney machine as part of the management of kidney failure. Artificial kidney machine means dialysis machine. So here heparin is the correct answer. Option B. In this picture we can see the one of the tube is fixed in the dialysis machine. This is heparin tight, called as heparin tight. During the dialysis time, prevent blood clotting purpose, the heparin tight is used. Next question 90. Arthroscopy is a. What is arthroscopy? We will see here options. Option A causes of arthritis. Option B risk free. Option C is considered minimally invasive. Option D consider major surgery. Arthroscopy is also called as arthroscopic or keyhole surgery is a minimally invasive surgical procedure on a joint in which an examination and sometimes treatment of damage or joints. Some of the treatment for sometimes we can treat with a damaged joints also with the arthroscopy. It is a inserted into the joints through a small incision. Here in this picture we can see the small incision into the joints through this small needle. This arthroscopy done is considered as minimally invasive. Option C is the correct answer. Here next we will move on to question number 91. The physician prescribes an order for the nurse to discontinue a patient's nasogastric tube. Before removing the tube, nurse should do. Doctor as advised to remove a nasogastric tube, NG tube. The nurse role is what? We will see here option. Option A, aspirate gastric content. Option B, avoid oral foods to patient. Option C, assess for client bowel sounds. Option D, none of the above. Disconnect the tube from feeding and suctioning if present. Remove the tape or secure device from the nose and unclip the NG tube from the client's gown and verify the tube placement. Then clear the nasogastric tube by inserting 10 to 20 ml of air into the tube or prevent aspiration. Any remaining gastric content is there or not, we have to assess first. Assess for the bowel sounds. Option C, assess for client's bowel sounds is the main role of nurse. And also first to encourage plenty of fluids to the patient and observe patient is having any nausea or vomitings. Otherwise next after 1 hour 2 hours to encourage liquid fluids like milk or oats milk. Then provide a soft diet further few hours of post removal of nasogastric tube. Next we will move on to question number 92. Which part of the uterus is called as living ligature of uterus? What is the part of uterus is called as living ligature? We will see here options. Option A, endometrium. Option B, perimetrium. Option C, middle layer of myometrium. Option D, inner layer of myometrium. Middle from crisscrossing muscle fibers acts as living ligature during involution of the uterus and prevent blood loss when the placenta separates from the uterine wall. These fibers contract and conflict the blood vessels. This blood saving mechanism is called as living ligature. Living ligature. It is called as living ligature is middle layer of the myometrium or living ligature also called as physiological sutures of the uterus. So here option C, middle layer of the myometrium is correct answer. Living ligature of uterus is middle layer of myometrium. Next we will move on to question number 93. Which of the following is most dangerous complication during induction of spinal anesthesia? The dangerous complication during induction of spinal anesthesia from the options. We will see here options. Option A, hypotension. Option B, hypertension. Option C, tachycardia. Option D, bradypnea. Serious neurological complications after spinal anesthesia are rare but do occur. The most common are post-dural puncture, headache and hypotension. Minor complications like nausea or vomiting, shivering, itching, hearing impairment and urinary retention. But here dangerous complication during induction of spinal anesthesia is hypotension and headaches. So here hypotension is there in this option. Option A is the correct answer. The main and dangerous complication during the induction of spinal anesthesia is hypotension. Next we will move on to question number 94. Quada equina syndrome is. What is Quada equina syndrome? We will see here options. Option A, related to hypotension. Option B, a surgical emergency. Option C, related to hypertension. Option D, a medical emergency. CES, Quada equina syndrome, is a condition that occurs when the bundle of nerves below the end of the spinal cord known as the Quada equina is damaged is called as Quada equina syndrome. The signs and symptoms like low back pain, pain that regulates down the legs, numbness around the anus and loss of bowel and bladder control. So here a surgical emergency is Quada equina syndrome. Quada equina syndrome is a surgical emergency. Next move on to question number 95. A fibroid tumor is also known as. What is the fibroid tumor is known as? We will see here option myeloma, option B myotic, option C myalgia, option D myoma. For discussing regarding answers, we will see here what is these options medical terms. Myeloma. Myeloma is a cancer that forms in a type of white blood cells is called as plasma cells. Means it is a blood disorder. Next option B, myotic. Myotic is a one of the eye disorder. Contraction of the pupil of eye. Contraction of the pupil of the eye is called as myotic. Next option C, what is myalgia? This Myalgia only is there. Myalgia means pain. Pain in the muscles or group of the muscles is called as myalgia. Here fibroid tumor is also known as myoma. Fibroid in the tumor also known as myoma. Uterine fibroids is also called as myoma. Myoma are growth that appears in the uterus made of uterine muscle. 75 to 80% of people with a uterus will be diagnosed with fibroid. So here option D is the correct answer. Next we will move on to question number 96. Which of the following is a late sign of the development of a tension pneumothorax? Not early sign, late sign of the development of tension pneumothorax. Options: option A hypotension, option B hypertension, option C tracheal deviation, option D tachycardia. Late sign of a tension pneumothorax is that the trachea will eventually shift to the unaffected side. So here option C tracheal deviation is the late sign of development of tension pneumothorax. Pneumothorax will quickly see hypotension. It is the early sign. Hypotension we can see in these pneumothorax cases. Not only hypertension, in early signs or hypotension, tachycardia and dyspnea as the mediastinum shifts from the extra pressure in the intrapleural space on the affected side. So here late sign of development of pneumothorax, tension pneumothorax is tracheal deviation. Next we will move on to question number 97. Nurse is assigned to care for a client who has returned to the unit after left nephrectomy. Nurse have to give highest priority to B from the options. Post-operative period after the left nephrectomy, patient is received to the unit. The nurse role is what? We will see here options. Option A temperature monitoring. Option B able to turn side to side. Option C hourly urine output. Option D blood pressure. The vital signs are main important of post-operative few hours of the post-operative period. But here left nephrectomy means related to kidney disorder, means kidney related to the kidney surgery. So we have to assess urine output of the patient. Intake and output chart we have to maintain. Main priority we have to give here hourly urine output of the patient. As a nurse, necessary to measure urine output hourly. It is a most important role in nursing practice. This is done to assess the effectiveness of remaining kidney, also to detect renal failure is there or not. We have to early assessment to be done. Postoperative nursing care. Postoperative nursing care is monitor and document accurately the patient's fluid intake and output to prevent further complications of surgery. So here option C hourly urine output is the major role of the nursing post-operative case of left nephrectomy. Next we will move on to question number 98. A bleeding disorder characterized by deficiency of factor 8th and 9th is termed. The deficiency of factor 8 and 9 bleeding disorder is known as. We will see here options. Option A hemophilia, option B purpura, option C leukemia, option D thrombocytopenia. People with hemophilia have low levels of either 8th or 9th factor. A severity of hemophilia that person has determining by the amount of factor in blood. So the lower amount of the factor, more likely is that treating bleeding will be occur, which can lead to serious health issues also. Here hemophilia is the correct answer. Hemophilia, the 8th factor is hemophilia A disorder and 9th factor is hemophilia B disorder. So here these both are comes under the hemophilia characteristics disorder. So here option A hemophilia is the correct answer in this option A. Next we will move on to question number 99. What is the best method of evaluating the amount of peripheral edema? How to evaluate patient is having peripheral edema? What is the method? We will see here options. Option A measuring the extremities. Option B IO chart, intake and output chart monitoring. Option C observe type of edema. Which type of edema? Pitting edema or non-pitting edema? Option D, weight monitoring daily. First indicator of peripheral edema is measuring the extremities. Measures the extremities with a tape and area should be marked with a pen, providing the most objective assessment. The best method to evaluate the peripheral edema is measuring the extremities. Option A is the correct answer here. The secondary. This is best method. Not only measuring the extremities, we can evaluate through the weight monitoring of the patient also. Through the measuring the extremities and weight monitoring daily is evaluating amount of peripheral edema. These both, but priority is measuring the extremities with the tape, and we have to do a marked with a pen and providing a objective assessment for the further days. Here option A is the correct answer. Next, move on to question number 100. The last question in the medical surgical nursing point of view. We will see here that question. The most common reason why amputation is performed as. The most common reason for amputation cases. We will see here options. Option A, result of infection. Option B, due to the chromosomal abnormality. Option C, due to trauma. And option D, due to the peripheral vascular disease. Due to the infection and due to the trauma, we can go for the amputation, undergone for the amputation, but most common reason is due to the peripheral vascular disease. The most common causes leading the amputation are diabetes mellitus, peripheral vascular disease, neuropathy and trauma. The most common reason for the amputation is wound that does not heal. So here option D is the correct answer. What is peripheral vascular disease? Peripheral vascular disease, often this can be from poor circulation because of damage or narrowing of the arteries, is called as peripheral vascular disease. So here the common reason for the amputation is due to the peripheral vascular disease. Till now we finished medical surgical nursing 100 questions, main important or very important, and previous years frequently asked questions also. In upcoming videos we will discuss in previous year's question paper. In the MHSRB previous year question paper, I will explain in further video. Please stay tuned friends. Please subscribe my channel. Click on the bell icon for further notification. Please friends, like a video and share video to your friends and support me friends. Please subscribe my channel. Click on the bell icon for further notification. Stay tuned friends.